Hello, my name is Charlie and my friend thinks I have a drinking problem. I personally do not think it is a problem. I enjoy every sip. Tex has nothing but nice things to say about you, but I do not understand why you brought me into this room. Do you not have a more professional setting?
Hello, Charlie. I have been expecting you. Tex has told me all about you and your partying.
Before we talk about me, Doc, I have to ask, why are you wearing a bloody apron and carrying a meat cleaver? To be honest, you are scaring me. Normal doctors do not look like meat butchers.
Charlie. Let's not waste your time and more importantly my time. Can you not see I have a patient I need to attend to as soon as possible?
Okay, Doc. You do not look like a man that I would want to make mad. Let's talk about why I'm here.
Yes, Charlie. Let us talk about you. Can you tell me why you are here today? Other than your friend Tex recommending you come here?
Well, apparently I am a walking example of every clinical manifestation of liver cancer that is possible. My stools are chalky white. I have jaundice, which I thought it was just a bad spray tan. My abdomen has been increasing in size, which some may call swelling. But most importantly to me, I have had a little nausea lately. And I must admit my occasional vomiting is not winning me any lady friends. Before we start talking, Doc, I need to tell you that it is going to be next to impossible for me to stop drinking. It just makes me feel so good and handsome.
Charlie, I am not here to judge your lavish lifestyle. I am here to educate you and tell you what your options may be. I hope you realize that you do need treatment. And you need it sooner than later.
Options? Treatment? What are you talking about? I am just here for a checkup and some information. Not for treatment. Check your chart and let's have a safety timeout because I think you got the wrong guy.
Yes, options. And yes, you need treatment. I hate to break it to you, but you do indeed have liver cancer. And if you do not act, it will kill you. Are you ready to talk about your treatment options?
Liver cancer? How did this happen to me? I did not even notice the warning signs. I am sorry, Doc, but I need to either sit down or have a drink. Preferably both. I cannot relive my luck. Why does this stuff always happen to me? First house arrest, and now liver cancer. I just want to be a normal guy.
Charlie, luck has nothing to do with liver cancer. Yes, some people are more prone to cancer than others. But your habitual drinking habits did not help your body defend your liver from cancer. Charlie, let me be honest with you. I am assuming by the smell of your breath and the stench of your clothing. You are drunk right now. Your liver is so large I am surprised that you are able to stand in an upright direction.
I may be slightly buzzed, but I am hardly drunk. I am willing to listen to your treatment options. There are so many beautiful women in this world, it is not my time to leave just yet.
One of the options for treatment is surgery. The patient in front of us was diagnosed in the early stages of liver cancer. If your cancer is in an early enough stage, this too could be an option for you. I am no fortune teller, but something tells me that you are not in the early stages of liver cancer. So let's move on to other treatments, shall we?
I am a little relieved that surgery is not an option. By the looks of that meat cleaver in your hand, personally I have a safety concern. You look a little more than dangerous.
So you do not like knives? How do you feel about needles? Radiofrequency ablation is another treatment option for liver cancer. This treatment utilizes a small needle inserted into the core of the tumor. The needle will supply energy to heat and kill the tumor.
Needles are not a problem for me. Tell me more about injection options.
4 types of treatment are available in concern to needles and probes. One of the treatments we have already talked about. Cryoablation is another type of treatment that we offer. This is where a probe enters your liver and delivers liquid nitrogen which freezes and destroys the tissue around the probe.
Well, the freezing sounds interesting. Keep going, Doc. You said I have 2 more options for treatment.
If you would stop interrupting me, I could have told you about the other 2 options already. The third option is to inject ethanol or acetic acid into the tumor to kill the cells.
Acid? Are you kidding me? I am an alcoholic, not a junkie. You can keep your acid.
That is one simple mind you have, Charlie. You are just incredible. These are medications and medical procedures I am describing to you, not recreational street drugs. Anyways, before I was so rudely interrupted, the final type of injection is chemotherapy. These chemotherapy drugs are injected into the hepatic artery, which supplies the liver cancer with blood.
Well, thanks for the information, Doc. I need to get going. I have a hot date tonight, so I must be off.
I was not done talking to you, Charlie. I have a few more options for you to consider. I still do not think that you understand the severity of your liver cancer. The two options remaining are a liver transplant and targeted drug therapy. I hope I do not have to explain what a liver transplant is to you.
No, Doc. I think I know what a liver transplant is. But why would someone want my liver?
God bless you, Charlie. You are a special man. A liver transplant consists of your cancer-infested liver going into a red garbage bag, and then a donor's liver taking its place inside your body.
Oh, well, that makes sense. What treatment are you recommending for me?
Well, first, Charlie, we have to determine which of the 4 types of cancers you have.
I thought you just told me that I have liver cancer. Now you're telling me that you do not know what type of cancer I have. Stop playing with my mind.
Allow me to elaborate. There are 4 types of liver cancer. Hepatocellular, which begins in the liver's main cells. The second type is cholangiocarcinoma, which begins in the liver's bile ducts. Angiosarcoma, which begins in the liver's blood vessels. And the fourth type is hepatoblastoma, which most frequently affects children less than 4.
Okay, well, are you going to tell me which type of liver cancer I have?
Well, assuming your liver cancer arises from your alcohol consumption, it is a safe bet that your cancer is hepatocellular.
Wow, this is just too much to take in. Here's my plan. I am going to go meet up with these girls I met the other night, have a few drinks, and then think about my treatment options. Do you think you could prescribe me something for my nausea?
Absolutely not. Why would I aid you in your alcoholism? You need some healthy natural sleep so you can consider your options in a clear state of mind. Please call me when you're ready.
Okay, Doc, I will consider your advice. But to be honest, I really like my plan better. I will be in touch. Hey, now that I think about it, you should come out with me tonight. Girls love surgeons.
Goodbye, Charlie. And good luck.